As the novel coronavirus infects more people worldwide, the information and misinformation are spreading faster than the virus itself.
Infodemic means the spread of false, baseless pieces of information.
More countries are now imposing travel restrictions, closing their borders to visitors from China, Hong Kong, and Macau.
Yung mga foreigners po kanina, the decision of quarantine and immigration were to send them back.
Imposing mandatory quarantines on returning nationals, the absence of a cure, the non-availability of a vaccine, paranoia is on a steady rise.
Sample from a 60-year-old female Chinese patient tested positive for the novel coronavirus.
There is clear evidence of human-to-human transmission.
We'll dispel the mounting coronavirus rumors, the false claims, and miracle cures in this CNN Philippine special presentation, Just the Facts. I'm Pia Hontiveros. The fear of the novel coronavirus is widespread. It's affecting the way we live. Our planned activities and schedules are changing, and every day more people are getting sick. There are more than 31,000 confirmed cases of the novel coronavirus worldwide across 25 countries and territories. 630 people have died, and the majority are in China. Here in the country, there are 3 confirmed cases, all of them Chinese nationals. One has died. He was a 44-year-old man from Wuhan, China. His partner, a 38-year-old woman, remains in hospital here. And the last one, a 60-year-old woman who has since returned to China. Aside from these confirmed cases, the government is also keeping an eye on a number of other individuals. Let's go live to our Trisha Terada. Trisha, we understand there are a number of patients under investigation, which means they're showing symptoms of the coronavirus.
Yes, Pia, correct. The number of PUIs is increasing. It's now at 250. Number of confirmed cases remains at 3, while 57 have tested negative for nCoV. Authorities are still waiting for the results of 155 PUIs. We're seeing most number of these cases in Metro Manila, followed by Calabarzon and Western Visayas. In a way, these numbers are making sense as authorities have reached out to more possible contacts of the first 2 confirmed nCoV patients, a little less than half of 441 contacts they need to trace. They've also started contact tracing for the 3rd nCoV case. Problem is, there are 9 PUIs refusing to be admitted.
Some of them are also afraid na yung gastos sa ospital, although at this point the government is shouldering the expenses of our patients.
Aside from the 9 who refused hospitalization, 184 are currently admitted. 17 have been discharged but still under strict monitoring. 3 are dead, but the recent fatality has nothing to do with the nCoV. The PUI died of a lung disease and he already tested negative for nCoV. Pia?
Yeah, Trisha, tell us about that first case, that 44-year-old Chinese man, his remains. No? There's a lot of discussion about what or how his remains, like we quoted earlier, were disposed of properly. The questions about why the funeral parlors would not accept his remains be cremated.
Well, the authorities are telling us that the body of the 44-year-old victim has already been disposed properly. They're neither confirming or denying the process if it has been buried or cremated for the family's privacy. But again, no crematorium agreed to do the services for the cadaver. That's because they are afraid, or authorities are saying that they are afraid that it might have an effect on their business eventually. If people would find out that they did the services, that's why it really took so long. If you remember, the patient died Saturday, so it took almost a week before his body was disposed. Yeah?
Tricia, so they won't say where and how his remains were disposed of properly, like you were saying earlier, but did they say that it is safe, that it is not a public health hazard to cremate the remains of a nCoV confirmed case?
Yes, Pia, that's correct. Authorities are saying that if the body is disposed properly or correctly, if it's buried, there is no problem with that. But the thing is, their priority was to just really do the cremation as following the protocols of or the health standards. Pia?
All right, let's talk about that first confirmed case in the country, the Chinese woman. She's still in this government hospital in Manila. How is she doing?
Yes, Pia, she's recovering well according to the authorities. And in fact, she already tested negative for nCoV, but she can't just be discharged yet because experts have to do a second run, which has to test negative as well before she can go.
All right, we're expecting 56 Filipinos who are being repatriated from Hubei province this weekend. Of course, that everybody knows that was ground zero for the novel coronavirus detected in December. We know many people in the New Clark City area are very concerned about using that venue as the quarantine area. But plans are pushing through to use New Clark City, right? What are their concerns?
Yes, Pia, that's correct. Authorities, the local government is concerned they're afraid that it might be transmitted among the residents. But the Health Secretary, Francisco Duque, is allaying the fears of the residents and even the local government. He's saying that nCoV is not airborne. In fact, it can only be transmitted via droplets. So with this, he's saying, and in fact, besides this, he's saying that the lockdown facility is even far from the community. So with all these being said, they're sticking to the original plan. The quarantine facility will still be at the Athletes Village in the New Clark City. And in fact, Duque will also be talking personally to the Capas Tarlac mayor to explain to him that there is really no risk. Even Health Undersecretary Yusek Domingo saying that all agencies will be making sure that the OFWs from Wuhan will not get in contact with the community once they're there. Pia?
So that's clear. New Clark City as a quarantine area will be safe. Trisha Terada there reporting. And just as we were talking about these Filipinos from China preparing to come home, the Municipal Council and some residents of Capas, Tarlac, opposing the idea of using New Clark City as a quarantine site. Trisha did say, though, that Secretary Duque will be speaking to the mayor of the town. In the meantime, our George Cahiles reports.
We are here in Sitio Camatis in Capas Tarlac, and as you can see, this community is just a few hundred meters away from the New Clark City, which houses the state-of-the-art sports complex that was used during the Southeast Asian Games last December. Authorities now eye another use for that sports complex, as its Athletes Village is now identified as a quarantine site for overseas Filipino workers who will be repatriated from Hubei, China, the ground zero of the novel coronavirus outbreak. All of the New Clark City is now on a lockdown, and authorities currently making the necessary preparations for the quarantine site. Residents here in Sitio Camatis are now in fear after learning that repatriates from China will be quarantined near their community.
Yung bagong kumakat na sakit niya kuya, yun ang naalala namin dito kuya. Ito magkaawa-awa po yung taga rito. Una po yung mga kapatid ko nagtatrabaho po dyan sa Green City. Kung pwede lang sana kuya, huwag mo nang papuntahin dito sa Pilipinas. Kawawa yung mga kababayan namin dyan sa Capas.
Using the New Clark City as a quarantine site does not sit well with the local government of Capas. A strong opposition from the local leaders was raised as they expressed their preparedness to bring the issue to court.
Just recently, pinag-uusapan is Fort Magsaysay. And then suddenly, Capas Tarlac. Parang pinag-aralan ba talaga ito? Although the administrative jurisdiction is with BCDA, sana man lang, tinanong kami, nag-coordinate, at least kung magtatanong yung mga constituents namin, we could explain.
During an emergency session at the Municipal Hall earlier, representatives of the Health Department were grilled. Why choose Capas over other areas? Why were local officials not informed ahead of time? Questions that only the national government can answer.
They should know na droplet ang source ng transmission. So, from 3 meters away, hindi mo na makakatch yung infection eh. For us to think na bago ka makapasok sa NCC, malayo eh.
The health department says the issues residents have raised are clearly products of lack of information about the nCoV. But local officials say if they were only informed ahead of time, they could have prepared their residents for this scenario. From Capas, Tarlac, George Cahiles, CNN Philippines.
The chairperson of the House Committee on Health says the government could have done better and responded sooner to the coronavirus outbreak. Representative Angelina Helentan spoke with our Pinky Web today.
Merong lapses. Ako personally alam ko kasi I was informed from the ground na medyo natagalan yung interim guidelines. It's supposed to be the guidelines coming from the Department of Health na ibababa mo sa regional office ng Department of Health. At ang regional office, sila magka-cascade down to the provinces, provinces down to the municipality, municipality down to the barangays.
Correct.
Ito napakahalaga kasi nakasaad dito yung mga tools na pwede mong tingnan paano ka magde-decide. Are we actually ready? Hindi lang doon kasi sa pag sinabi mong response, parang ang tinitingnan lang natin ay may facility ba tayo na pagdadalhan. Sa akin, ang pagtingin ko, ang kahandaan dapat, una, may knowledge and skills ba yung mga tao na key para makatulong ng departamento, di ba? At alam natin, hindi lang yan yung mga nasa hospital base. Ang pinakamahalaga yung nasa ground.
Right.
So, mukhang nagulat din sila.
We're trying to understand just the facts of the novel coronavirus. This is a CNN Philippines special presentation. We're bringing you just the facts of the novel coronavirus in this CNN Philippines special presentation. I'm Pia Hontiveros. An outpouring of grief and anger on Chinese social media channels over the death of Dr. Wenliang. The Chinese doctor was among the first to identify the new coronavirus. On December 30 last year, Dr. Li told a group of colleagues in a social media chat about 7 cases of a disease similar to SARS. But Chinese officials reprimanded him for spreading rumors. He tested positive for the virus on February 1st. Chinese state media reported Dr. Li's death this morning. The World Health Organization issued a statement saying they are, quote, deeply saddened by Dr. Li's death. Amnesty International criticized Dr. Li's death as an indication of human rights failings. The death toll now stands at 638. More than 31,500 people are infected with the coronavirus. The majority are in China. CNN's David Culver joins us live from Beijing. David, before anything else, last week when we spoke to you, you were in the middle of that 14-day self-imposed quarantine because, like we said, at the time you had just returned from Wuhan.
Right. That's right, Pia. Yeah, and we have since exited that quarantine. A lot of folks, hundreds of Americans, thousands of folks around the world are likewise embarking on their own 14-day quarantine. That seems to be the timeline, the 2 weeks that is being recommended by health officials so as to check yourselves and your surroundings for any potential symptoms. Those who are around you would be me and my team as we were in a hotel, essentially kind of in our own self-lockdown. Just making sure that we didn't expose ourselves to others either. And we have now, of course, since emerged, but we were, while in quarantine, still able to report, still able to continue to be in touch with the people of Wuhan and Hubei province. And that's the intention here, is that we wanted to make sure that we were still getting those firsthand contacts and hearing directly from those who are impacted and still within what is now, Pia, a widening lockdown zone.
David, what else can you tell us about how things are going there in Beijing and also, well, in the entire China when it comes to the latest on this coronavirus?
I think the biggest headline, and you touched on it a little bit at the top, but it cannot be overstated, and that is the death of Dr. Wenliang. This is somebody who we were in touch with just a week or so ago, and we told his story a few days ago. And even my colleague, my producer, Yong Shong, was touching base with him 24 hours or so before he passed away and was communicating with him by WeChat message because Dr. Li couldn't speak essentially anymore. His breathing was heavily labored and he was in a lot of pain. But he was somebody who wanted to continue to tell his story. And it is very telling, Pia, that he was willing to share his story with us, with CNN, a foreign media outlet. Initially, he shared it, of course, with Chinese state media. But what we saw even after the announcement of his death is shocking, really. I mean, you're seeing folks on all sides. You're seeing activists, of course. You're seeing police officers, local officials, and officials from around this country who are united in their mourning. I mean, there is a profound grief that is coming across Chinese social media right now, and that's being combined a little bit with a deep outrage. There's anger, too, because people feel as though had this person's voice, along with several other whistleblowers, we should tell you, been listened to early on, things might have been different. Perhaps the containment would have been taken place early on, and this spread would not have been where it is today. Those are the questions that, of course, coming across Chinese social media, but they're being quickly withdrawn, we should say. They're being censored. And that's something that people are noticing as well. I mean, this is not, that they're ignorant of that. Chinese folks are quite familiar with it, and they're seeing it happen here, yet it is not stopping them, Pia, from expressing their anger and their frustration and really pouring forth with tributes.
That's right. So much anger and outrage on social media. Well, interesting. Censoring also, like you were saying, that David Culver, live from Beijing. Amid the epidemic of the coronavirus misinformation, we want to focus on just the facts. We have our guests here in the studio who will help us break it all down. Joining us is Health Assistant Secretary Rosette Vergere, Dr. Anna Ong Lim, the President of the Pediatric Infectious Diseases Society of the Philippines, and also with us, Dana Sandoval. She's the spokesperson for the Bureau of Immigration, and Jeffrey Seitz. He is the CEO of Fix Genomics. Thank you all of you for joining us here in this program. But before anything else, since that was one of the big stories that we led off with, let's talk first about the remains of the first death of the nCoV confirmed case, this Chinese man from Wuhan. So there was that big question about what does the health department mean by disposed of properly? And number two, ma'am, can you tell us, as Assistant Secretary Vergere, is it a public health hazard to cremate or to bury, meaning 6 feet below the ground, an nCoV confirmed case?
Yes, Pia, actually, if we look into our sanitation code of the Philippines, we'd find that in the provisions for burying or disposing of the remains of people or persons who die of infectious diseases, it's stated there that within how many hours after death you're supposed to bury the person. Second, you have to put it in an airtight bag and all of these procedures.
Yeah.
Now, this law would state that you need to dispose of the remains either by, it's burying the remains of this person. So as to if it's a health hazard, if we have buried it or if we have cremated.
It is not.
It is not, as long as the procedures were done properly according to the guidelines.
Yeah, well, that's very important to hear because earlier health department authorities were saying that they couldn't find a funeral parlor that would take his remains and cremate them, when actually, hindi pala problema. It is not a problem.
Actually, we had challenges at the start because it was true what Yusek Domingo was saying a while ago, that we had issues with the funeral establishments because most of them were refusing because, this is something that the information was getting out of hand and they are fearing for their establishments. But after some time, we were able to facilitate and manage the disposal of the remains.
Ma'am, you're the first one I asked questions of because the DOH, like we're always told, it is the health department that we should all listen to and not to anyone else. So all the announcements, all the statements should be coming from you. Yes. And dapat, in other words, hindi dapat tayo maniwala sa ibang tao.
Yes, that's true, Pia. Actually, we'd have this infodemic, as what the Secretary would say in all of his briefings, that people are spreading fake news, people are listening to anybody, and the information is getting out of hand. So we are urging the public to please refrain from getting information and from other people. Just listen to DOH, go into our website. You can call our hotlines for specific information that you would want to know. But we just like to assure the public that DOH is on top of this. We are working together with the other national government agencies, and only DOH has the information specifically for those positive cases and the persons under investigation.
And I think the most important, of course, is to keep calm and to follow all these, there are so many, I don't know, safety protocols, basic infection control procedures that we can follow. And Dr. Anna Ong Lim is here also with us. Ma'am, can you tell us, some people do panic, no? I mean, like, for example, parents who have kids in school, the school authorities, anywhere where there are big crowds, a big number of people converging, di ba? So what do you advise parents and school authorities in terms of, how not to panic? What do we do? And I know this is a question that's always asked, and I know the answers have been forthcoming in the last 2-3 weeks.
Right.
No? But it's good to repeat them.
Yeah. So I think the key to managing the panic is really just focusing on the facts, as this program is meant to do. And if we understand, actually with any infectious disease, if you understand how it's transmitted, then that's really how you're supposed to prevent being infected with that particular organism. So in this case, we know that this is transmitted by droplet, which requires close contact, a maximum of 6 feet. So, for example, if you're in a public area where it's basically open air and it's not too crowded, the chances of getting anything are extremely low. But conversely, if you're together with a lot of people in a crowded place, then the risks multiply. So that's why the initial recommendations from public health have been the same. You try to avoid crowded places, you keep yourself protected when you're in such areas. If you happen to be exposed, then you need to wash hands frequently. You protect others from your coughs and sneezes, and so on. So it's basic hygiene.
Basic hygiene, things that we learned way back in kindergarten. Things that you doctors have been telling us ever since we were born. Our parents ever since we were born. No? Like you said, no, wash your hands. Even drink water. And I know doctors always say 8 glasses of water. Nobody takes it seriously, but that's a really big thing, right? So these are basic infection control practices that we can observe so that we can go about our daily activities without being paranoid or without panicking, right?
Agree.
Okay. And in other words, what is the underlying message here? Is that is it that this is preventable? Like you were saying earlier. I mean, as long as we don't... Containable.
It's containable.
Okay.
So that's precisely why the measures that have been implemented have really been directed towards trying to prevent people who are highly likely or who might be likely to be infected from spreading the virus if they have it. So that's the whole idea behind identifying persons under investigation and persons under monitoring. And for now, because we're fortunate that we don't have transmission in the local population, we've focused on travelers, whether they are locals or foreign nationals, as long as they come from areas with identified high number of cases, we put them under quarantine.
Right.
So I guess it really just requires all of us to be very cooperative with these screening measures, because if we comply, then we don't just help ourselves, we help our families, we also
we help
help
the community, we help the country.
Exactly.
No?
Exactly.
And kanina, pinag-usapan, David Culver is talking about self-imposed quarantine, which is what everybody, if you did fly in from any of those named areas already, you should be doing that. But we have a question first from social media, and we're trying to get everyone to participate in this conversation. This is from Twitter, from Mateo Efron. And we quote, bakit po ang tagal ng lab results para malaman kung sino talaga ang may nCoV, and how do we treat patients with nCoV? Maybe let's focus on the, he thinks that it's taking so long for the lab results to get back in. Who can explain why?
Actually, we have a standard timeline for the lab results before it gets released. There is this 24 to 48 hours timeline for the Research for Institute of Tropical Medicine to release the results. With the influx of the increasing number of persons under investigation now, there is this delay that they have identified. And this is causing some form of challenge for the system currently with this response that we are having. But on Monday, we already have this meeting together with our regional directors to somehow provide some strategy so that we can ease this traffic with these laboratory results that we are talking about. We aim, or the objective is to expand the laboratories, the capacity of the laboratories into our different regions so that we can make the laboratory results faster. No? We can release it at once so that we can discharge patients or we can advise patients at once.
Mm-hmm. Well, we're about to show our audience a story about masks. And, for the longest time, there was a lot of discussion about masks, coming from the Taal volcano eruption and now nCoV. But before we go to that story, ma'am, just tell us, wearing a mask is optional. And it should be really for those who are sick.
Yes.
Right? Okay. We'll go back to that discussion just a bit. In the meantime, wherever you go, people wearing masks, like we were saying, they're constantly wiping their hands with alcohol or hand sanitizer. It's become the norm. In various schools around the country, students are required to take extra precautions. In some cases, temperature checks are mandated. Our Caroline Bonkin reports.
Instead of holding a flag ceremony at a covered court, pupils and teachers of General Licerio Geronimo Elementary School in Manila City do it inside the classrooms. School officials take it as a step against the novel coronavirus.
Kasi maliit lang yung aming covered court, so may possibility na kumalat yung disease in the event na meron man.
At the gates, the guard checks each pupil's temperature before letting them inside. If a child's temperature reaches 38 degrees Celsius, a member of the faculty will bring him or her to the nearest hospital.
For proper disposition. Kasi after all, di naman natin alam kung nCoV ba yun or whatever.
Before he says, teachers also ask pupils to wash their hands. Happy birthday to you! 2 happy birthday songs while cleaning their hands with soap and water for 20 seconds. A habit Abby and her classmates learned even before the nCoV outbreak.
Sobrang importante po para po maging malinis po yung kamay natin, tsaka po buong katawan. Kasi po yung kamay po natin kung saan humahawak.
Aside from monitoring the faculty and students' health, the Education Department also suspended off-campus activities like field trips, contests, and trainings, while the nCoV poses a threat to everyone in school. Sick students and teachers are advised to stay at home for at least a day. Parents also taking extra steps to protect their children. This mother shows us a hygiene kit that the Parent-Teacher Association is giving to pupils at a school in Quezon City. There's alcohol, a towel, tissues, wet wipes, and soap. She also says she adjusted her children's routines outside of school.
As much as possible, hindi sila pupunta sa mga crowded places. So I will not let them go out if not needed naman. So other than that, I let them wear masks going to school.
Education officials aren't recommending class suspension, but some private schools in Metro Manila opted to cancel their classes for a week or 2, some upon the parents' request. Most of these schools have students who went to China last Chinese New Year. Other schools used the time to sanitize its facilities. So the Education Department just reminds them to hold makeup sessions to complete the required number of school days. Caroline Bonkin, CNN Philippines.
You're watching a CNN Philippines special presentation, Just the Facts of the Novel Coronavirus. This cruise ship docked in Japan has the most number of people with the coronavirus outside of China. We'll go live to Tokyo for the very latest. You're watching a CNN Philippines special presentation. The information and misinformation about the novel coronavirus admittedly overwhelming to so many of us. We want to bring you just the facts. I'm Pia Hontiveros. There is one place with the most cases of the novel coronavirus outside of China, and that's a cruise ship docked in Yokohama, Japan. CNN correspondent Will Ripley joins us live from Tokyo. Will, how many people on board infected with the coronavirus? And there was a video of a passenger with a sign saying medicine lacking. How are people getting that medical attention?
Hi, Pia. It's so good to be with you. And the news is not good for the 3,700 people on board the Diamond Princess behind me, because they learned in the course of one day the number of coronavirus confirmed cases tripled from 20 to 61. So we now know that at least 61 people who were on that ship have tested positive for coronavirus, including an American woman from the state of Oregon who I spoke with today, who, the patients on the board are running out of medications. There was actually a sign hanging over the side of the ship written in Japanese saying medications lacking. People say that they're running out of things for, diabetes, for conditions like MS. There are obviously cruises are very popular amongst senior citizens, and there are a lot of retirees who are on that ship. And we also know, Pia, which is very dangerous, the fact that coronavirus, the vast majority of deaths, and there are now some 600 deaths globally out of 31,000 cases, the vast majority of those cases in mainland China, but the highest concentration outside of China on that ship right there. And we know that with so many senior citizens on this boat and concerns that they're breathing in air that's being circulated around the ship, a lot of people feel that they're kind of being quarantined in a very unsafe environment right now.
Wow, Will, 20 to 61, like you were saying, in just the last 24 hours, and so many, like you said, senior citizens on board that ship. And I'm sorry, you're in Yokohama, Will. How much longer will the ship be there, and what are Japanese health officials doing?
We believe that at least for the next few days, the ship's going to stay right here docked in Yokohama. Although there was talk at some point about moving the ship back out to sea. The problem is, if they continue to learn about new cases, those patients need to be brought off the ship by ambulance, which is why it's probably likely that during the quarantine period, which is going to last till February 19th, if not longer, the ship might stay here. So this is obviously a really difficult situation, because most of the time, for like 23 out of 24 hours a day, the passengers have to stay inside their rooms. Now, some of the lucky passengers who paid more for their cabins might have a balcony or a window, but there are a lot of people who got the more affordable rooms that are inside the interior of the boat. These are small cabins that don't have windows, and again, people are panicking, because not only are they basically confined in this small room, which can almost start to feel like a prison cell after a while, but they're really concerned about fresh air and not being able to step outside, not being able to see the sunshine, and wondering if this virus, which, scientists still don't know that much about it, if it's airborne and if it's actually, coming through their air filtration system into their rooms. So you can imagine the mental anguish, even for the people who are healthy on board. The cruise line has said that they're trying to do everything they can to make this quarantine period, it's not going to be pleasant, but, as tolerable as possible. They're bringing people food to their rooms, trying to speed up that process. The food described, not very good. Certainly not the lobster buffet that passengers were enjoying on the luxury liner just over a week ago. But also, they've added extra channels on television so that people have more programs to watch. They're putting together, gaming packs so people can play cards and stuff in their rooms. But, for some of the people, like, for example, the American woman who's now told she's going to have to be in a quarantine ward at the hospital for 2 weeks, her husband is left sitting in their room by himself, no one to talk to.
Wow, it's Feb 7 today, and you said hopefully by the 19th this quarantine ends. It's 12 days. 12 more days of this. Will Ripley there reporting from Yokohama about that cruise ship. Will Ripley saying that from 20, that number of confirmed cases, nCoV, on that cruise ship has tripled in the last 24 hours. A similar situation in Hong Kong. A cruise ship is quarantined at the Victoria Harbour in Hong Kong as a precautionary measure. There were 3 former passengers on the World Dream cruise to Vietnam who tested positive for the coronavirus. That trip took place from January 19 to the 24th. All 4,000 passengers disembarked at 2 stops, one in southern China and then in Hong Kong. Dream Cruises officials are contacting these passengers to check on their health or for them to seek medical attention as or if needed. The cruise ship has picked up other passengers since. There are now 1,800 of them on board with the same number of crew members. They're being tested for the virus and are not allowed to leave. Health officials have been saying our first line of defense against the coronavirus is proper hygiene. Joining us still here in the studio, Health Department Assistant Secretary Rosette Vergere, Dr. Anna Ong Lim, the President of the Pediatric Infectious Diseases Society of the Philippines. Also with us, Dana Sandoval, of the Bureau of Immigration, and Jeffrey Seitz, he's the CEO of Fixed Genomics. So earlier, there was this talk about masks, and then just a while ago, just so that we can address this issue, Will Ripley was saying that there are fears about, is this airborne or not? It's not, right? So far, what do we know? Jeffrey, would you know, or Dr. Anna, or from the DOH, what do we know? Or it's just really droplets by droplets?
So the current understanding of this virus is that it is spread by droplet transmission, which is the reasoning behind all of the recommendations once again.
Yeah.
If it's by droplet, then we don't really say that we need masks because only people who are in close contact with those who are sick or who are actually sick will be needing a mask.
We're talking about the situation of the cruise ship because, like Will Ripley was saying, the fear of the passengers who are quarantined in their own individual rooms are that this could be airborne already, and that, for example, the cabins that have no windows, so they're just breathing the same air, or there's all that fear. Yeah, Jeffrey.
Viruses need a host. They need something to live in. And so they're not going to survive for a long period of time outside of a host.
Okay.
So looking at the optional need of a mask, I think the mask would be a lot more applicable to those that are showing symptoms than those that aren't.
Right. In other words, if you're sick, then
you're much more likely to be. The mask is more useful because now you're protecting other people.
Right. And if you're not sick and you're wearing a mask, that's most likely because you're a health worker attending to these sick people.
Yes.
Yeah.
The viral particle is also small enough to pass through a mask, and it also has been shown to be contracted through the eye. So unless you have a mask really tight around your face or even beyond that, you can still find that the viral particles will enter. So the mask is more applicable to those that are showing symptoms than those aren't.
Okay. Just a while ago, Dr. Anna, you were saying that from what we know at present, because exactly that's the reason why it's called a novel coronavirus. It's so new, It looks like every day we're just discovering something about it. There are scientists, people who are studying it. So at this point, we're saying that it's not airborne. You can't get it if it's airborne. The only time it is airborne is if someone who has it sneezes in your direction and the droplets fall on you.
Okay.
Ganun ba?
So
is that correct?
we should define what we mean when we say airborne versus droplet.
Yes.
When you say droplet, that means that the particles that travel are large enough so that they are only suspended in the air up to a certain distance over a certain period of time. And that's where the calculation for the 6 feet comes from.
Yeah.
So airborne, on the other hand, means that the particles are able to travel over longer distances. And as is the case for some of the respiratory viruses. But for corona, MERS, SARS, novel coronavirus, these are viruses that are transmitted through the droplet route. So meaning that only close contacts are the ones that are actually at risk.
Okay. There's another question from Instagram. Eman Simpao asking, should we really be worried about this, or is it just blown out of proportion? Because the way we're talking, and everybody's like a broken record already, practice these basic infection control procedures, basic health safety measures, etc., and you'll be fine. And as long as you're not sick, you don't have any underlying health issues, then you'll be okay. So is this all blown out of proportion, or are we being vigilant and careful?
I think it's
Jeffrey.
perfectly reasonable to be vigilant. We don't know enough scientifically to not be vigilant. I think that's where we are today in terms of understanding this virus. Genomics has done a great job to provide us with the information that we have right now, and it's been wonderful to create the diagnostic kits that we have today to be able to assess this problem. But there's still not enough information to really understand how this transmission is happening. We don't know exactly how long the incubation periods are. There seems to be a whole lot of unknowns. I think that's where a lot of the panic is coming from. We know from influenza the time period where we are going to get sick as a globe. We know how many people are going to die every year from influenza. We know when the influenza season ends. We don't know any of that for the coronavirus. And this is where the anxiety comes from, because we don't have answers. So the panic, and to put it into perspective, and what I tried to look at this myself and go, okay, is this really a big problem? Is how toxic or virulent this species is. We have roughly 300 deaths a month so far out of this virus. We have over 7,000 deaths a month from influenza.
Right, right.
So
if you look at the scale of things.
If you look at the scale, I mean, okay, this is a very rampantly spreading virus, but we have immunity as healthy individuals. We are going to fight this thing. Mankind is going to beat this thing. We've got the Australian scientists making great progress in developing vaccines. They just published today that they're now able to take this petri dish of the virus that they've grown up outside of China for the first time in the Doherty Institute, and they have now grown it up in large scale. So that large scale of production allows the development of a vaccine. So we're working towards that. So I think we are overreacting. I think from the scientific community and those that understand the science behind viruses, and I'm not a virologist, but I'm a genomics scientist, I think a lot of who I speak to say, look, there's an overreaction globally about...
so far we're okay, in other words.
So far we're okay.
And as long as we do all these basic health and safety measures, then we'll be fine. And as long as, we're not sick, we have, like we said earlier, no underlying health issues.
The majority of these cases are comorbidities as well, right? That have been reported in terms of deaths.
Okay.
Maybe, Pia, one way to think about this is the global effort, I guess, in containment is really just to make sure we prevent a large-scale death rate, if I can put it that way. Because if you think about it, now we're reporting something like 30,000 cases and 600 deaths. But if it spreads across borders at a much faster rate, then that 600 deaths can be multiplied several times over. And of course, nobody wants a high death rate, absolute numbers, because of course that's not...
Well, like you said earlier, this is containable. Dana Sandoval, of course, is here of the Bureau of Immigration. She's the spokesperson. Dana, kanina we were talking to Will Ripley about all these travelers quarantined on board that cruise ship in Yokohama. There's another cruise ship also in Hong Kong. We, the Philippines, has, how would we say it? Is it kind to say closed our borders to certain people who came from certain areas? No, and these are precautionary measures, right?
Yes, Pia. We have implemented a travel ban from people coming from China and its special administrative regions, which is Hong Kong and Macau. But it doesn't mean that it's a travel ban for the Chinese only, because this virus is not selective. It doesn't choose the Chinese only to be its host.
It's anyone who flew in from any of those areas.
Yes, it's any foreign national who flew in from those areas. So we're preventing that, and anyone who came from that area within the last 14 days, which is the incubation period for this virus.
Okay. Should we have... Well, I don't know if the BI should be the one to say it. Maybe the DOA Health Department. For a time, some people were saying we should have imposed the travel ban much earlier. Should we have, or was it just timely? It was tama lang ang timing.
There were a lot of considerations actually, but when the situation, as reported, was being it's being monitored, we have convened the Interagency for Task Force for Emerging Infectious Diseases, where the DOH co-chairs this with the Department of Foreign Affairs. And upon review and recommendations coming from different agencies, then it was decided that there should be this temporary ban for travelers coming from these areas which are affected actually by the coronavirus.
Although there was some observation that, we should have done this earlier, then we wouldn't have so many cases, we wouldn't have 1 or 2 deaths here. no, that is not the case?
Well, I don't think that would be something that we should think about right now.
Yeah.
What we should think about is how to contain this and to work together as a nation.
And Asik, what you're saying is that every time we make an important move like this, after all, what we are, clamping down on is travel and trade also, of course, with all these business going on. The government has to go through a very deliberative and deliberate process. Now, this is something that you can't do just like that.
Of course, because it has a lot of implications. Actually, as I've said, we have this Interagency for these emerging infectious diseases. And just this afternoon, I came from a meeting from the National Disaster Risk Reduction Committee or Council, where the Secretary has asked the NDRRMC for support from all of the national agencies as members for them to support us in our campaign and our response for nCoV.
All right, we're going to continue this discussion in a bit, but before that, there are billions of stories online about the novel coronavirus. It is top of mind for people all over the world, and while there is so much to learn and understand, just a while ago you were saying that we're still learning so many things about it as we speak, there is a lot of fake information getting in the way. Our Cheska Buencamino has more.
From false claims about cures to conspiracy theories on bioweaponry, it's no surprise the new and deadly virus would cause fear among the public. Several social networking sites are taking action to make credible information more accessible as the internet is struggling to contain fake news. Facebook is removing bogus content and unproven theories that have been flagged by global health authorities. Here in the Philippines, if you type coronavirus on the search bar, an advisory will pop up directing users to the health department's website. Twitter is doing their share. A similar notification will also appear. Users will be greeted with a bold headline that reads, "Alamin ang katotohanan" or "Know the facts," and will be directed to the website of DOH and the Twitter account of the World Health Organization Philippines. For those who prefer consuming information through videos, YouTube prioritizes clips from credible sources like news outlets and health experts. A box also pops up on top of the page leading to the latest information from the WHO. With misinformation spreading like wildfire, the Philippine National Police warns netizens that fake news peddlers can land them in prison. Authorities say those found spreading false information may face jail sentences of 6 to 12 years pursuant to the Cybercrime Prevention Act of 2012. It remains unclear if violators will include those sharing social media posts originally uploaded by others. Well, just how much coronavirus content is out there? Google the word and you'll get over 1 billion results. For its part, the world's top search engine has dedicated a space for preventive measures against the virus, with hand washing topping the list. More safety tips and mythbusters can be found on the websites of the Health Department and the World Health Organization. With misinformation causing more harm and confusion to people who believe them, the DOH reminds the public to remember the letters nCoV before sharing news on the deadly virus. Cheska Buencamino, CNN Philippines.
We'll be back after a short break. This is a CNN Philippines special presentation, Just the Facts on the Novel Coronavirus. Welcome back to a CNN Philippines special presentation, Just the Facts on the Novel Coronavirus. The World Health Organization is rushing to speed up research on the novel coronavirus. Researchers and health officials are meeting on Tuesday and Wednesday next week in Geneva. Again, as we've been saying, there is no vaccine or specific treatment for the disease at the moment. We're joined here in the studio by our guests, Health Assistant Secretary Rosette Vergere, Dana Sandoval, spokesperson for the Bureau of Immigration, Dr. Anna Ong Lim, President of the Pediatric Infectious Diseases Society of the Philippines, and Jeffrey Seitz. He is the CEO of Fix Genomics. Jeffrey, before we go any further, can you tell us what is genomics in one sentence and why? Wow. Yeah, I know. Wow. No, we'll give you an hour next week. And why does this figure in this debate that is going on about coronavirus and all these questions and, unanswered questions?
So genomics is a simple definition. It's the complete genetic makeup of a species, of an individual. So we used to look at the genes of an individual. These are the acting mechanisms that drive our phenotypic features, what we see, our eyes, color, our height. These are the things we call phenotypes. But there's so much more that drives the whole genotype, and that is the complete genetic makeup of the individual. That is the genome. So genomics has really transformed the ability to capture information quickly. If you looked at traditional epidemiological techniques, we would normally grow a bug up in a dish, and then we would do some pathological studies, and that could take months, if not longer. Now we can collect that information in just one day, if not less than that. And so not only do we have the ability to collect information, we also have the ability to share information. There's something called the Global Initiative of Data Sharing for All Influenza Data. I think it's a database. And within that database, there's now 53 genomes that have been published, and scientists around the world have access to that information. So they go in, they capture that information, and they start studying what's going on, and they start comparing it. So the information we have today, we know the genomic information about this, and that's why we call it a novel virus. We know the origins, that's also because of genomics. Where did this start? And we're also able to follow transmission because of genomics. So those are three main applications of genomics in this fight of the novel coronavirus.
I like what you said earlier that, well, and just to paraphrase, it's almost like you're saying, keep calm, we've got this. As long as we stay healthy, as long as we practice all these infection control measures, then we'll be okay.
Well, really, what else are we going to do?
Yeah.
We have a limited amount of knowledge. The knowledge that we have today doesn't give us enough actionability. So we follow these mechanisms that we're familiar with. We thankfully have experienced SARS and MERS, and we've learned from those processes. There's a lot of the features, genomic features that are similar to SARS that scientists have discovered. So the only thing I've also been asked so many times on social media and through my family and friends, should we panic? And the only thing I can come back to, because I don't know all the answers and there isn't enough information out there, is that we follow these procedures that we're very familiar with, and that is Vigilant, Hygiene.
Vigilant, Hygiene. Like, we were saying earlier, wash your hands, drink water, drink your vitamins, stay healthy, stay away from people who
We're also talking a lot about what they call social distancing, right? So stay at home, don't go out as much into these public spaces.
Yeah, okay, stop the mauling. Okay, and also, like for example, just for the doctors to tell us here, like sneezing, for example, or coughing, as much as possible into a tissue, for example, and not, just out there.
Oh, yeah.
Not
again, basic hygiene, right?
Again, basic hygiene, yeah.
If you remembered your lessons from kindergarten, when you sneeze, when you cough, you're supposed to cover it. If you don't have tissue handy, then you're supposed to sneeze or cough into the crook of your elbow, so you try to catch whatever secretions you have. So all of this, I think, really, we just need to reinforce these practices and make sure that always wash your hands, because they're really the most efficient way to transfer any kind of bug to anybody else.
Yeah, and as the doctors say, drink lots of water. Yeah. It works. What is the all-around cure? Anyway, we'd like to thank our guests for tonight. We will continue this conversation for a few more minutes on Facebook. But first, thank you to Assistant Secretary for Health, Rosette Vergere, Dana Sandoval, Bureau of Immigration, Dr. Anna Ong Lim, and Jeffrey Seitz, the CEO of Fixed Genomics. Thank you very much for being here. Maraming salamat. This is a CNN Philippine special presentation, Just the Facts on the Novel Coronavirus. I'm Pia Hontiveros. Thank you for watching.